So welcome everyone. I am Miranda Stiers. My pronouns are they, them, and I am joining from the partnership. Excuse me. I am the Associate Director of Capacity Building and Prevention, and I am joining from the lands of the Nisenan, Miwok, and Maidu people in what is the occupied lands of Sacramento. And as we get started, I just want to share a brief land acknowledgement. Give me one moment. Oop, and of course it's not out. There we go. Are folks able to see it now?
Yes. You
Okay,
can.
perfect. So at the partnership, we acknowledge that we are on the traditional homelands of the California Native people, which is, we know is over 120 federally recognized tribes and many more who are still working on uh, recognition. And so want folks to understand that having that federal recognition opens up a lot of opportunities and supports for the tribes and opens education, funding, etc. So I would encourage folks to look into the native lands for your area and what are the needs of the native folks in your area. One of the things we know is that for the Nisenan people, their rancheria was shut down, and they don't have federal recognition, and they have been working diligently to do that because of the genocide of the history. They are working very hard to encompass their language and make sure that future generations know their language and their culture. So I'll put a link in the chat for everyone. And with that, I am going to pass it on over to Gretchen. Thank you.
Great. Thank you, Miranda. Hi, everybody. Happy Friday. Hope you are all doing well. I am going to share my screen here so we can start to dig into Path Cited. Just curious if you want to put your name in the chat and maybe the county that you're working in, and then are you thinking about applying for Path Cited? We'll be curious to know where folks are today with their Path Cited. So I have two other co-presenters here that will be joining me today. Allison is going to be helping with all of the chat. Baljeet will be presenting on a few of the agenda items, and then myself, and we're all excited to be back with you guys again here today. Our agenda, well, this seems a little light. It's actually pretty comprehensive. We are going to be doing a Path Cited overview, so learning more about what Path Cited is, how it potentially could benefit your organization. And then we'll be talking about the application itself and point out some tips and tricks for applying if you were interested in doing that. And if you're also just here to learn before you even decide if you want to apply, that's what we're here for as well. And then we'll be covering something new and exciting, transitional rent. And why we're including this into our cited webinar is that part of the cited funds are going to be prioritized for transitional rent providers. So we can share with you what we know. We're still waiting for their guidance from the state. But we will share with you what we have here today. As always with our webinars, we'd love to have you ask questions throughout the presentation. You can raise your hand, you can come off mute, you can put it in the chat, whichever way works best for you. But just please feel free to jump in as we go through our slides here today. And we will be getting these slides out to you later, probably early next week, actually, since it is Friday afternoon. All right, love seeing everybody jumping in here. So interested in learning more, great. Looking to learn and decide if you want to apply, wonderful. Okay, great. Well, again, ask questions as they come up today. So let's jump into Path Cited overview. So Path is this big umbrella that the state has created. And it's really trying to create different ways to support ECM and community supports providers. And one of the things that they have started through PATH is going to be the cited, which we'll talk about here today. And that's the Capacity and Infrastructure Transition, Expansion, and Development Initiative. Long acronym here. And this is really a grant program the state is doing where they give out grants directly to provider organizations or organizations who are interested in becoming a provider. So one of the rules they have, which is a little tenuous, but they like to have folks apply for cited who are either already contracted to provide ECM or community supports, or who are in the process, which could even be just we've talked to our managed care plan, we want to get a contract. We're not there yet. That's fine. But they also are being a little bit more flexible around folks who may be serving broader organizations or helping to support multiple providers with ECM and community supports. Great news is they have given us a few more months to apply for Pass Cited. Initially, the application deadline was March 7th. They have since extended this to May 2nd, which is good news. And that is primarily to incorporate transitional rent into this application round. We do have all the links in the slides. So when you do get the slides, you can have the links. I see Allison is also putting them into the chat as well. There is a really great website for Cited. I encourage all of you to look at it. It has a lot of great webinars the state has put out. The state is also doing office hours throughout the next few months. And so if you do have questions, you can log on and get those questions answered. Or if you're still interested in learning more, you can jump on and see what folks are asking. So Pass Cited is an important part of ECM and community supports. It is one of the primary funding opportunities to get infrastructure and capacity building dollars out to the providers. The Pass Cited is run by the state and their third-party administrator, Public Consulting Group. The other program that does provide similar dollars is called the Incentive Payment Program, or IPP. And those dollars were given from the state to the managed care plans to use for ECM and community supports. Most plans have spent down the majority of their IPP dollars. A few still have dollars left, and they may be using them for very targeted purposes. So if you are interested in seeing if the managed care plans in your county have IPP dollars left, I encourage you to reach out to them and ask. A lot of them are trying to do a final push, alongside Pass Cited to get folks the dollars they need to really be successful at ECM and community supports. So as I mentioned earlier, the state is running the Pass Cited initiative, and they've hired I think it's actually public. I put down Pacific here, forgive me. Public Consulting Group here, PCG, to be the third-party administrator. And they really act as the go-between between the state and the grantees on Pass Cited. So when you go to the office hours, when you submit questions into the Pass Cited email inbox, PCG will be responding to all of that and will be facilitating the webinars. I just wanted to put this out there so you do know that it's not the state directly running this grant program. It is PCG, and they're typically pretty responsive around the Pass Cited issues. So as I mentioned, we have exciting news where we have, I think I skipped one here, excuse me, where we have a brand new community support service that was approved by the federal government in December, and that is transitional rent, and that is our 15th community support service. It is not yet live. It will be optional for managed care plans to go live with on July 1st of this year. And then it will be mandatory for managed care plans to start to offer January of next year. And we expect most managed care plans to wait until January. The policy guidance is still coming out. We expect the state to make a big policy announcement in April with more details on transitional rent. And so they probably won't have enough time between April and July 1st to really be able to launch, but you never know, a few of the plans may do so. And we're going to cover transitional rent later on in our webinar here today. But just so you know, that was approved, very exciting, and we'll be talking about that further. And you can apply for cited dollars to support a transitional rent program. So let's jump in and talk more about Pass Cited. Again, this is capacity and infrastructure transition, expansion, and development. A lot of words there. Cited is a better term for it. And it's really to give those startup dollars or those expansion dollars to people or to organizations that are doing ECM and community supports. It is considered grant funding, so you apply for the grant as you would for most grants, and you do have reporting mechanisms. And we'll talk about that a little bit later, but you do have to set up milestones and try to reach all of those through Pass Cited. Funding can be used for a wide range of items. It can be used to pay for staff salaries as we get folks hired to actually do ECM and community supports, or the administrative side of your organization to help run those programs. It can be used for training and recruitment of staff. So if you need to hire more staff, you can use cited dollars to help support those efforts, as well as training. And we'll talk about the training, what's allowed and what's not allowed later on today. They also really encourage folks to use past-cited dollars to help purchase IT, billing, data management, care management systems to really support ECM and community supports. The one thing they really would like to have folks think about if they're going to use cited dollars for IT purposes is that making sure the system you're purchasing or you're building out can really be interoperability. It's Friday afternoon. My words are just not coming here. Forgive me, but to really make sure that you can work with the MCP systems as well. Another thing that I think a lot of folks don't think about, but the past cited can fund is doing outreach campaigns. So let's say you're already an ECM provider, but you really want to attract more ECM clients, get more referrals in. You can use past cited dollars to run an outreach campaign. So thinking about what does that look like with flyers, with trainings. We've had some groups talk about doing advertisements on buses. So there's many different ways to think about this, but past cited dollars can support those types of efforts as well. And then the eligible populations for past cited are really folks that are just ECM or CS providers looking to become providers or who are serving a broad range of ECM or community supports providers. When you do apply, you have to be very explicit as to how past cited is going to help ECM and community support services. How will it help expand, increase the folks who are receiving these services? So past cited round 4, which is the application window that we're currently in, is the last and final round of past cited. So as you can imagine, it's going to be a very competitive application process, and we'll talk about some of the priorities the state is putting forth, and that will help you kind of understand where their mind's going to be as they review applications. Unique to round 4 is that this will be a 1-year funding cycle. Previous rounds have been 2-year funding cycles, so it's going to be pretty rapid. And the state is pushing this idea of being shovel ready, something that you are ready to spend those dollars on day one once you receive them. So they really want to see that you are ready to go. The planning's done. If you're going to be using a vendor to set up an IT system, that you've already selected that vendor, maybe you even have a scope of work already approved. You're just waiting on the funding to make that happen. So think about being, again, this term is the state's shovel ready. There is no limit on the amount of past cited funds you can request. The average in previous rounds has been $1.1 million for a 2-year cycle. So that gives you a sense of the scale and scope of what they're going to be funding here. So a lot of possibilities here, a lot of opportunities to really help you enter into ECM and community supports or expand your services. So the funding priorities, here's what the state has put out. We're going to talk about how we figure out what are these gaps they're talking about. So they want to see that you are really in tune with your community that you're serving. So what are the gaps in your county-specific ECM and community supports? Now, there's state data that's been published. It's a little bit old. It's about 6 months old. But you can look at the data and say, hey, we're really not enrolling folks from the birth equity population, for example. How do we start to increase enrollments and referrals into that? How can I fill that gap? There's also the statewide ECM community supports gaps and the ones the state has identified, which aren't necessarily what's most important for some counties. What the state has put out there has been the birth equity population of focus, the justice involved population of focus, and of course, they're wanting to launch transitional rents. They're pushing for providers and particularly counties to get involved in transitional rent. So we want to make sure that we're identifying what are the gaps in our community. Do we not have enough providers serving folks experiencing homelessness? Do we not have any providers that are doing recuperative care, for example? So I want to see that you're listening in to what those gaps are, that you've read the data. The other great thing to do is you would like to go to your local collaborative. The PATH collaboratives are in each county, and listen to what's being said there. A lot of the collaboratives are now talking about gaps and needs in preparation for past cited. And so if you have some gaps and needs identified in your collaborative, you can use that as part of your cited application. Other priorities for the state are tribal entities or entities serving tribal members. They really would like to fund more organizations in rural counties. So if you live in a rural county, it's important that you highlight that in your application. I'd like to say that if you just listed the county, that PCG in the state would know that that's a rural county, but some of the reviewers for these applications are not from California, may not be aware of what's rural or urban. So I really encourage you all to highlight, if you're in a rural community, highlight that you'll be serving folks in a rural community. And then they also have looked at who have we funded over the past 3 rounds of Pass Cited. And so they're saying if we funded a lot of folks in LA County, we may want to prioritize other counties, for example, make sure they're getting a fair share of the cited funds. So we can talk more about what that looks like. And I do have a map that shows you what's been funded and where it's been funded in the previous rounds. And then they'd like to also prioritize entities who are serving individuals whose primary language is not English. As always, is a push to fund local community-based organizations. So making sure that they're not just funding organizations that are serving multiple counties or statewide. And then again, this transitional rent push, they're looking for counties and other organizations who want to do transitional rent. And I see we have a question in the chat from Michelle. Do we need to have CalAIM funding in order to qualify for this grant? There's no requirement for funding. What is required is that either you're already contracted with a managed care plan for ECM or community supports, or you're in the process of contracting with the managed care plan. There's a letter of attestation that you'll have to submit if you are not currently contracted for ECM or community supports. And that's simply, it's an attestation the managed care plan will write on your behalf, but it's really trying to say that we have been talking, we're both interested in contracting for ECM and community supports, and that will open up Pass Cited for you. There are a few other exceptions. If you're in a hub model, there can be some other ways that folks who are not currently contracted can start to get cited dollars, but pretty much you need to be in that contracting process. All right, any other questions? Allison, thank you for that response too. A big question we often get around Pass Cited is, can we use it for retroactive expenses? And the state does say that you can use Pass Cited funds for round 4. You can apply for them for expenses you incurred beginning January 1st, 2022 through January 5th, 2025, which is the cited application opened January 6th. They're saying you can apply for retroactive funding for that time period. So if that is something of interest to you, just make sure you have your dates correct and how you write it. They additionally have some guidance around retroactive funding requests on the PATH website. So now that we kind of know what the priorities are, we know that there are a lot of counties out there who have received a lot of funds. We know there's counties out there that haven't received as many Pass Cited awards. And so how is the state going to start to think about the evaluation of all of the applications they're going to receive in this last and final round of Pass Cited? So they really want to make sure that the applications that are submitted align with the identified priorities, which were on that previous slide. And again, if you're looking for gaps and needs in your community, it's going to be important to have some reference document, some reference point to cite in your application to really show this is an identified gap in need, and we're trying to address it with these cited applications. We also want to make sure that there's a good justification and the statement of need for Pass Cited funding, again, that aligns with the CalAIM overall program goals and with your community's gaps and needs. We also want to make sure that you're really clear on how you're going to use those Pass Cited dollars. And most importantly, how you're going to, if you're going to hire somebody, how do you sustain that staff person beyond the Pass Cited awards? So looking to really understand, how does this fit into you building your ECM or community supports program or expanding it? And then how you're going to get funding to continue those efforts once you've expended the cited award. They do ask for a sustainability plan. And for a lot of folks who apply for Pass Cited, that can be, well, we're trying to start ECM. And so once we start earning revenue through ECM, that will sustain our program. And that's perfectly acceptable. They just probably want to make sure that you're thinking about that as you submit your application. Additionally, they want to make sure they have this equitable distribution of funds, and I have the map on the next slide we'll cover, but they're really looking for folks in counties that have not been funded very much in previous cited rounds. They also want to make sure that you're talking to folks in your county. So you're in communication with your managed care plans, you're attending your PATH collaboratives and talking to other providers, that you are a part of other collaboratives if you're not part of the PATH collaborative, and really engaged with the community and understanding where the gaps and needs are for ECM and community supports. And again, we want to really drive home that we're trying to expand these services, make sure that we can reach more of the people who can benefit from ECM and community supports. So here is a lovely map of California. The darker colors are the counties that have been well-funded in previous cited rounds. And of course, the lighter colors reflect the counties that have not been as well-funded. And so again, I think it's important if you are in one of those counties that has not been as well-funded, you're going to be, have a priority point or two. I'm not quite sure how they're doing it, but they're going to prioritize those. But even if you are in LA County, which is the darkest county on the map here, that does not mean you shouldn't apply. We're still trying to make sure that we're filling the gaps and needs in all of the counties. So just make sure you're very explicit about how you're going to use cited funds to really address an identified gap or need. So what happens? So once you submit your application, we do expect the state will be taking some months to review all the applications, and we don't expect funding to actually be available until the end of 2025. So that's what we're talking about here. So once you do receive the award, you can start, thinking about spending dollars. So if you need to start your IT program, you need to start hiring staff, you can start to move forward once you receive that awardee letter. And then you're going to have to create some milestones in your application. You're going to want to create milestones very strategically, make sure they're ones that you can achieve. In the 1-year funding cycle, make sure that they're very reasonable. And if you need to, if you're trying to hire staff, we know that's not always straightforward and predictable. So you may want to give yourself a few extra weeks or months to say you're going to hire staff within a certain time frame. And you also want to create, what am I trying to say? The milestones that are really going to be tied to your budget. So we want to make sure everything is lined up and is seamless and makes a lot of sense from the state's perspective. Typically, you don't get funds until you've completed certain milestones. So if you're trying to hire staff, you may want to think about how you create milestones that will get you some funding when you actually need it. So be very strategic about creating those milestones.
All right, Gretchen, there's a question. Oh, sorry. Question in the chat. If the county has been funded, does that mean a smaller group needs have been met?
So just because organizations have been funded within a certain county, let's take LA County, which has received the most cited dollars, that does not mean that all the gaps and needs have been filled or met. There's still going to be gaps and needs there. What it does mean is you're going to be really explicit if you're in LA County about what gaps are out there. So really think about that. Make sure you have data or reference points to cite in your application around that. But I encourage everyone to apply for PATH cited, even if you are in a county that has been well funded in previous rounds.
And Gretchen, if I can just jump in too, I think as domestic violence service providers, I think it might be good to highlight that you might be working with a population that is not being adequately reached by other providers potentially.
And so we'd have to figure out how do we establish what that need is. And so I think that's where we have to be creative with our gaps and needs. Is OC eligible? Is that Orange County? So all counties are eligible, and we encourage organizations from every county in California to apply. We just know they're going to be prioritizing organizations that are in counties that have been underfunded in previous rounds, but everybody should apply. I also think that domestic service providers have not been a group that has been funded significantly in previous cited rounds. There's a lot of room to make your case of what the gaps and needs are for the populations that you're serving. So here is the tentative progress reporting timeline, which does give us a window into saying when does the state expect to roll out the dollars to make the announcements for the awards. And the first reporting period of when you're going to have to say, here are the milestones that we identified as being in our reporting period number 1 is going to be January 1st through March 31st of 2026. So if we think about the funding timeline here, it's pretty extended out. So we're going to have to think about what can we accomplish? What are we going to need moving forward in this 1-year time frame between January 1st, 2026 and December 31st, 2026. The other big thing I want to point out is that if you do have expenses, if you're running behind on milestones and you don't meet all of the milestones by December 31st, 2026, you are not able to ask for an extension or to seek reimbursement for expenses that you incurred after December 31st of 2026. So just keep that in mind as you're applying. Make sure you have projects that are really going to be able to be accomplished in a 12-month funding cycle. And that's going to be really important. Again, set up your milestones to really be achievable and to get you the dollars when you actually need to spend them. And Allison, please jump in here. I know you have helped with writing milestones, so may have some insight as to what works and what doesn't for past cited.
Yeah, I mean, I think what you said is perfect. I think really thinking about the bigger expenses that you're going to have and making sure that even if part of that project can be completed within an earlier milestone, just help the cash flow for your organization is helpful. Just so the really large expenses you might have aren't coming at the end of the project. But I think also making smaller milestones is really helpful so that you're consistently having that cash flow for your organization.
Perfect. Yeah. And that's really important. I know we've had some organizations that applied early and did not design their milestones to be very strong, and they struggled a lot with trying to get the funding flowing in to meet those milestones. So really be strategic, make it as simple as you can. And I really like what Allison said about breaking the bigger projects into smaller chunks so you can get the dollars flowing throughout the year, not just in the last reporting period. All right, let's jump into the application. And we're going to throw in a bunch of examples here. I'm taking them from the state's webinars they've done for round 4. And so if you do want more information, the state has put the slides up from previous webinars, and they're really helpful as you start to work on your application. So there are different sections of the application. I'm going to just talk through the first few bullets, the applicant information and about your organization. These are pretty basic things. How many staff do you have on board? How many folks do you serve? So they're pretty standard questions, not about ECM or community sports, but about your organization in general. And then, of course, they're going to want to make sure that you qualify for past cited. So making sure that if you are contracted, you get to submit your signature page of your contract for ECM or community supports. And if you are not yet contracted, that you have a letter of attestation from a managed care plan saying there is an intent to contract with you. We also want to make sure that if you do have other funding that you've received, either through IPP, the Incentive Payment Program, previous cited rounds, the TA Marketplace, that you are listing what those funding supports have been and how round 4 past cited will not duplicate those previous funding awards. And then we'll talk about ECM and community supports, talking about what your project is and how it's going to address some of the identified needs in your community or statewide. And then we'll talk about your budget and how to make sure that your budget lines up with your narrative request, and that's key. So what are the types of documentation? Oh, I'm sorry. Let's see, how to get under managed care. So how do you start contracting with the managed care plans? Is that what you're asking?
Yes, yes.
Okay, perfect. So does everybody know who their managed care plans are in the county? If you don't, we can drop a link in to show which managed care plans are in each county. And one of the things I think about is if you don't know or you're not in conversations with them, is to think about or see if you can tell from the data you collect which managed care plans most of your clients are enrolled in. So maybe most of them are enrolled, and I'm going to pick Anthem, for example. So you would want to prioritize reaching out to Anthem and finding out what their contracting process is, and get a letter of attestation. And I really encourage you to start with that piece first. We had in the last round some cited applications that weren't submitted on time because the MCP didn't get their letters of attestation out soon enough. So if you are not yet contracted, I would reach out to your managed care plan or however many you have in your county and really start those conversations now to get that letter of attestation in time for the application deadline. Does that answer your question?
Yes.
Okay, perfect. And thank you, Allison, for dropping in the managed care plans by county. That'll be really helpful. And so there's also, if you're working with Kaiser, if Kaiser's in your county, Kaiser has a very unique contracting structure where you may actually be in contract with one of their network lead entities. And so if you have a signed contract from them, that will also support your eligibility for the cited funding. And then if you have already applied for Technical Assistance Marketplace, the TA Marketplace, and you had an attestation letter from your managed care plan for the TA Marketplace, you can use that same attestation letter for the path cited application as well. So hopefully that will reduce the burden for some of you out there. And then if you are a tribal entity or Indian healthcare provider, or Indian health programs or an urban Indian organization, you can use an MOU instead of a contract or a letter of attestation. So just keep that in mind. That is only for those listed organizations. Now, if you're going to apply for transitional rent, and we'll talk about this later, Baljeet's going to give us a whole big overview as to what we know now from the state for transitional rent. In addition to what we've already listed, you will also need a special letter of support from your county's behavioral health department. And the goal here is they want to make sure that as we roll out transitional rent, that our transitional rent providers are collaborating with the county behavioral health department. And this is brand new. And so I know we're going to have some county behavioral health departments who may not be up on transitional rent. So it may take a little bit more time again to get those letters of support. So I encourage you, if you're thinking about transitional rent, start those conversations with your county behavioral health department early and follow up with them. I know a lot of them are just getting this information. They're trying to process it too. So a lot of change is happening. And thank you, Allison, for dropping in the support letter template the state has put out. Any questions on these eligibility documents?
So,
Yes, please.
so this is the letter, the County Behavioral Health Department. This we have to get from our managed care person.
There's a couple of things. So if you're applying for transitional rent, in addition to having an attestation letter from your managed care plan or a signed contract with your managed care plan, you also need to have a letter of support from behavioral health department in your county. If you are not applying for transitional rent, you can just ignore that letter of support with your behavioral health department.
And transitional rent is for someone who's homeless.
So transitional rent is a new program that has not yet launched that is going to provide up to 6 months worth of rent for qualifying individuals. And of course, the state has rolled out a bunch of populations of focus for transitional rent, which we'll cover later on. But that's only if you're going to be a transitional rent provider. So keep that in mind. So a couple of additional funding considerations. We really want to make sure in your applications and your funding requests that we are explicit about what identified ECM or community supports need or gap you're addressing. And the state has a guidance document, and at the very end, there's an FAQ, and some of the things they reference for gaps and needs are pretty old, but I will just share with you what they reference here. They do encourage you to look at your managed care plan's needs assessment and gap filling plans, which are posted on the state's website. They're old. I'm just going to warn you about that. They're also looking for needs identified in the local homelessness plans. So maybe that your county has put forth or the COC in your county. And then again, every county has these collaboratives, path collaboratives that are funded by the state that really will be talking about what are the gaps and needs in each county. And that can also be used as part of the reference for what gaps and needs your cited application will fill. Okay, Selena, I see your question about transitional rent. We have a whole section on transitional rent, so I'm going to save that for Baljeet. But all of you here today could be transitional rent providers, but we'll talk about kind of what they're looking for and what those requirements are going to be. They're a little bit different than the other community support services, but I'm going to save all of that for Baljeet's section towards the end of the presentation. But thanks for your question. And then the other thing for your funding is that we really want to make sure that you also talk about what other funding you have received through previous past cited funding rounds, through incentive payment programs or IPP awards, through the technical assistance marketplace, through other grants that may impact ECM or community supports. So you really want to have you be explicit. Here's what we received previous funding for. Our past cited application is not going to duplicate those efforts at all. So here's an example of what the state wants you to say on this exact topic. So for IPP, they really want you to talk about what the funding was that you received and say actually how much you received through, in this case, it was for IPP. And then how was the other funding used? So how did you use those IPP dollars? And then again, making sure you're very explicit that your cited application will be used for different activities, different services. It will not duplicate what you receive the IPP funds for. And again, the state has many of these types examples. I also have one here for cited. So if you did receive previous cited awards, here's a good example of how to talk about how you received previous cited funding. And again, talking about how much was received, what was it used for, and making sure you say explicitly that this round 4 cited application will not be duplicating what you received funding for in previous rounds. So again, lots of good examples here, but it's going to be really important to be explicit. This is going to be a very competitive funding cycle, and we want to make sure that you are just very clear in answering all the state's questions to move your application forward. Any questions on these types of examples?
Is there any guidance or one-on-one support available for somebody who's going to do for the first time? You know, we are a small CBO and we have never ever done this. We get grants, but we get grants from foundations or state or federal, but have never done any such application before.
So Alice, I'm going to look to you to see if you want to answer the question about individual TA for past cited.
Yeah, so as Gretchen mentioned a little bit earlier, the organization that is putting out this funding is they have quite a few webinars on their website, and they also have some office hours coming up that can be helpful. Through the partnership, we will also be hosting another webinar a little bit later on in April to talk a bit more about this opportunity. And we'll also have some office hours that will be available just for domestic violence providers. And at the end of this webinar, we're going to have a survey. And if you are interested in additional information or support, you can give us your email in that survey.
Thank you.
Jennifer, I do see your question about, did I hear correctly that we will not be able to use past cited round 4 for what we'd use this for before? We want to make sure we're not duplicating efforts. So if you use past cited round $3 to purchase a care management system, let's say, you can't now use past cited round 4 to purchase the same care management system, right? You can use it to enhance your care management system, but we can't have you asking for additional dollars to the same thing you asked for in previous rounds. Does that make sense? And if you want to talk to me, give me an example of what you're thinking about. We can also talk through a real world example. Okay, well, if you think of one, feel free You don't have an example. Okay. So I don't know, Allison, let's talk about one of the ones that you may have applied for in a round 3 cited application.
Yeah, I mean, I think that example of a database or a platform is a really good one because that's a kind of a big expense. However, say you purchase that platform, but now you're adding a community support or you're adding another staff person that will need a seat in that database, you could charge for those extra seats within that database. If let's say you started a project and you thought you had enough staff. What you're realizing is that you might need another staff person on the administrative side of things, or like I said, like a caseworker to help you do another community support. You could add, those positions in part, however much they're going to be working on this project.
Those are great examples. And I think what the state's really looking for is they don't want organizations to rely on cited dollars for operational expenses. They really want these to be used to help launch ECM or community supports, or serving a new population of focus in ECM, or doing a new community support service, or even expanding it so you're serving more people. But they don't want to have you rely on this just for staff salaries. So they're looking for you to use these dollars once, have a sustainability plan, and move on. So that's kind of the intent behind no duplication here. So for ECM and community supports, they're going to be asking you a little bit more about either the program you currently run or what you're going to be using past cited for here. So they want to make sure that you list which populations of focus you are serving for ECM, or that you're going to be using cited dollars for, or the community support services that you'll be using past cited dollars for. So let's say that you are currently providing housing transition navigation as a community support in your community. If you want to use past cited dollars to expand the number of people you can serve in that community support, they're going to want to have you list that as part of your past cited application. So talking about what that community support service is, how many folks you currently serve, and how many cited dollars could help you serve if you were given the award. If you are currently an ECM provider, and let's say that you are serving the population of focus, individuals experiencing homelessness, and you want to add on a new population of focus, maybe those with SUD needs, for example, you would want to talk about how you plan to serve that new population of focus. What are the goals you have? Why you need to have hiring certain staff, or whatever you're asking for cited funds for that new population of focus. You will also need to be prepared to answer questions on the number of folks you currently serve in ECM and or community supports. And again, if you're trying to expand those services, what are the numbers that you intend to serve through the past cited funding? If you work in multiple counties, this is going to be important that you're going to need to identify your cited application request, what percentage of the award will go to which county. So if you work in 2 different counties, you'll need to be explicit about what percentage is going to go to county A you work in and what will go into county B. So just be prepared to have some of those questions and the data ready. If you're curious what the questions look like, we do have an application template that you can look at. The state has put that on the website, so that will give you a sense of the types of questions they're going to be asking, so you can get that data ready ahead of time. And then they also want to make sure that if you, let's say you're currently contracted to serve folks in that individuals experiencing homelessness population of focus, if you plan to add a new population of focus, you have to make sure that is in your current contract, or you have to ask for a letter of attestation from your managed care plan for that new ECM population of focus. So don't assume that just because you're contracted for one ECM population of focus or one community support service, that if you intend to add more populations of focus or more community support services, that you don't need to have a letter of attestation. You actually do. It needs to be very clear that you are contracted, or you have that intent to contract for those new populations of focus or for the new community support services. So the project description and justification, this is a part of the application. This is the narrative part, and it's going to be really important to be clear and concise. And again, I think it's important to think about having this be as simple as possible so the state really understands what your goals are with the past cited funding and how that's going to lead to folks getting ECM and or community support services. So you'll want to list the goals that you wish to achieve using those cited dollars, the populations and services that you will be serving with cited dollars. And it's not just the ECM population of focus or the community support services. It's about the different types of marginalized populations that you're going to be serving. So again, as a domestic violence organization, you may want to highlight some of the populations you serve and how they're going to benefit from ECM and community supports. I'm talking about the areas served and the needs and gaps that are going to be addressed with the cited dollars for ECM and community supports. And again, if you're in a rural community or a rural county, make sure you highlight that and say that explicitly. And then again, make sure that your budget and your narrative all line up. So as you list your narrative goals in this section of the application, make sure your budget supports your narrative goals. It's going to be really, really important. That's one of the biggest things that we have challenges with other cited rounds of funding. As I mentioned earlier, the state wants you to be shovel ready, so ready to do a one-year project. So making sure that the project you're asking for dollars for can be achieved within a 12-month period. So let's say you need to hire 15 staff. Is that really reasonable to do in a 12-month period? So just be really thoughtful about what you're asking for and the timeline in which it can be accomplished. You also, again, want to make sure that you're identifying what gaps and needs you're addressing with cited dollars for ECM and or community supports. Again, just be very explicit, just put it out there, make sure the state can identify that and move on with your application. And then what is the sustainability of your project after the cited funds have been expended? And again, if you're looking at staff, thinking about how will you start paying staff once those cited dollars have been used? Is that through ECM revenue? Is that through community supports revenue? Is that through other sources? You're going to need to be listing what those other sources are going to be. And then the state really wants to make sure they're funding organizations that have the expertise, the cultural awareness to serve the populations that you're asking cited dollars for. So again, just be very explicit, be very simple. What is your expertise? How is it benefiting the folks you're going to be working with in past cited? So here's some examples of some good project descriptions and goals. So our project aims to expand our current ECM program capacity to include the individuals with serious mental health and or SUD needs. We aim to achieve this goal by requesting cited funds to hire 4 new full-time staff. What I want to pay attention to here is 4 new staff to do ECM for this population of focus. And they're identifying what types of staff they're going to be hiring. So you need to hire 4 full-time case managers. That's going to be important too if you're hiring staff. What is the FTE you're hiring for, and what are the job titles that you'll be hiring for? You can also ask for consultants. You can hire consultants with cited dollars to help. It may just come in and help get your IT system reconfigured to serve these new populations of focus. So think about that as well. And then we're looking to say, how will hiring these new staff enable you to serve more people through ECM or community support? So really talking about what is the increased capacity, why is this important? All of this stuff is going to be important in your project example. Now, as we continue this, we're going to look and see what are the readiness plans for this, okay? And so in this example, the state has put out, they're really saying that, you know, if you're hiring staff, tell us how you're going to do this in a 12-month cycle. And so in this example, the organization talks about, you know, normally we hire staff in an average of 3 months. So if you have that data, put it in there. You may not have that, that's okay too. But we also know that we hire X number of staff per quarter. So given this data, we believe that we can hire these 4 new case managers within a quarter, but we're going to give ourselves some extra time. It's a hard job market. So we're going to say, you know, 6 months, which gives us a 3-month buffer to really hire these additional 4 case managers. So just be really explicit about how you can do this, why you know you can do this in a 12-month cycle. Just really put it out there. Okay, and a lot of other things are really important. So talking about what are the multiple planning steps that you've already taken so that you're ready to go on day one of getting these funds. And if there's any contracting issues that need to be, worked out, make sure you talk about that and how, again, you're going to be ready to go and really meet the goals within 12 months. And then the funding request workbook, this is your budget you're going to submit, and they do have a separate download, which again, as you're thinking about applying, I would download this and really look into it. You want to make sure that it matches with your project narrative and goals. So really make sure those line up. And again, want to be very simple and clear about what is the funding you're asking for, how will it be used, how it does not duplicate previous funding that you've received. So really just, lay it out there, be explicit with everything so the state can just really understand what you're trying to do and how it's not going to duplicate previous funding cycles. I'm looking at the time here and I want to make sure that we save time for transitional rent. So I may go a little bit faster through these next slides, but you will receive these. So you will have the information to refer back to. One of the big things around staff salaries is there are some restrictions around what types of staff you can fund with cited dollars. And so just being aware that you have to have a certain FTE met to be able to fund for cited dollars for folks that work directly with clients. So just be aware of that. And if you have administrative staff, you can apply for them as well if they're going to be doing the back-end support for ECM and community supports, whether that's billing, whether that's, doing all the case documentation plans, whatever it may be. You just need to make sure you justify how they're connected to ECM or community supports. Lots of slides on staff salaries, but it's really important that you think about this if you are going to be applying for staff salaries. And so just, read over these bullet points. The state gets kind of picky around FTEs here. One thing to note is that the state is going to add on an automatic 5% indirect cost to your budget request. So you don't need to factor that into your budget worksheet or your salaries request. So just be aware they do add that on automatically. So we don't want to have you add an extra line item for indirect costs. So quickly, we do have training as a great use of cited dollars. There is a limit, though. You can only use up to $4,000 per new staff for staff training. And they do have a lot of examples of what's allowable training they want to fund and what's unallowable. Thankfully, the allowable category is really broad. You can train your staff on how to use your new electronic health record or your care management system. You can use it to work on billing. So if you need to have folks do different types of documentation to bill for ECM or community supports, you can train them on that. You can do cultural sensitivity training, trauma-informed care, motivational interviewing. All of those are really valuable trainings, and cited dollars can be used to pay for those types of trainings. The unallowable training categories are pretty much ones that are very generic to having a job. So, looking at what is project management as a whole, those are not allowable training. How do we use Microsoft Word? Not an allowable training. And the state has all of these listed on their website as well. All right, any questions on the application before we jump into transitional rent? If you think of some, please drop them in the chat and we'll get back to you. And with that, I'll turn it over to Baljeet to talk about transitional rent.
Great. Thank you, Gretchen. Hello, everyone. So I'm going to go over transitional rent here and a couple of things before I get into that. So we did do one prior webinar that I believe is on the partnership website, and it really goes into CalAIM Essentials is what we titled it, and it goes into ECM. It goes into a little bit about community support. So if you're joining us for the first time and you're wondering, well, what is ECM? What is community support? I would definitely go back and watch that webinar first And then we have a deeper dive on ECM and community supports. And also we're going to cover the community health worker benefit as well, coming up on March 11th. And I believe it's at 12 o'clock. I have to go back and look at the time, but it's on March 11th. And so we're going to go into, well, what is ECM exactly? And is it a program that maybe you're already providing, but you call it something else? And then what are the 14 community supports, or the 15th, right, with transitional rent? What are those community supports, and are you already providing similar services in your programs already? And so is there good alignment there for you to become a provider of these services? So this is going to be a critical part of this assessment that you need to do as you start thinking about, I'm looking to apply, your organization is looking to apply for these additional funding. How do you get into this space? And you can become an ECM and a community supports provider. A lot of this is aligned. And so again, having that, understanding and information about what these benefits and services are as you look at applying for this, what we keep saying, last round of funding. And so really want to make sure that providers have all the information they can before they get into this. So let's talk about transitional rent. This is the latest and greatest community support. It was definitely one that was missing when we looked at the 14 community supports. They call them the housing trio. There's 3 community supports that have been around now since 2022, and that is housing navigation, housing deposits, and housing tenancy and sustaining, right? So when you think of clients that come into this housing and homeless programs, we're first trying to help them find housing. Then we're trying to help them move into housing by, paying first and last month's rent, any security deposits, any utility deposits. And then once we move them into these housing units, how do we make sure they stay? So that's considered part of the housing trio. And advocates, associations, the state quickly realized, and knowing our current housing crisis that we're dealing with in California, that housing trio is not enough, that folks need help with ongoing rent. And so we knew pretty early on that the state was going to look at adding additional community support, and it did get approved in December of last year. So late last year, right before, the Biden administration left office, it was approved. So next couple of slides, we're going to go into transitional rent. There is still a lot of information that we need to get from the state. They are working on policy around this, additional guidance around this, but what we're going to present to you is what we know at this point. So transitional rent has a little bit more, I want to call it, criteria than the housing trio may have. And so that's important to understand here. When you look up the policy guide under the housing trio for those 3, it doesn't go into this level of criteria that the transitional rent does. So for this, it's looking to provide up to 6 months of rental support through a member's managed care plan. So again, it's that individual has to be on Medi-Cal, and they also have to be enrolled in a managed care plan. Those are 2 critical things that need to happen here. And it's looking to help those members that are transitioning from institutions, congregate settings, or homelessness. And so your organizations are a great opportunity for this community support. This support is crucial in stabilizing individuals during vulnerable periods, significantly reducing the risk of returning to institutional care or experiencing homelessness. Now, because this is only 6 months, and we know 6 months is not enough time to help someone with their rent, and this isn't looking to be a long-term solution. This is really looking at bridging that member to more permanent housing solutions. And so it's kind of that maybe that gap that exists as folks are trying to get into these more permanent housing solutions and they need help right away. It's kind of helping to fill some of those gaps. So it's going to serve as a bridge to permanent housing for members who need it, and in particular for members with significant behavioral health needs. And so it's a bridge to that behavioral health transformation funding dedicated to housing interventions, which hopefully will provide permanent rental subsidies and housing once they come off transitional rent. And it's looking to provide that seamless continuity and supporting members in achieving long-term stability. Now, this benefit, like already mentioned, like it says on the slide here, it's only available for up to 6 months per household per demonstration period. And hopefully we'll learn more about, well, what does that mean? In the other housing community supports, it will say the state guidance will say, the policy guidance will say per lifetime max, right? One time per lifetime. This is saying per demonstration period. And so we need more guidance from the state around, well, what does that exactly mean? Now, the rollout of this is, it's going to be happening through the managed care plans, and then they're going to be looking for folks to come on to be providers of this. And just like how the state rolled out ECM and community supports, there is a very strategic and rollout of transitional rent. And so it's going to be in a phased approach by a population of focus, which we're going to get into here. And these populations of focus are different than the ones that are under the ECM populations of focus. And so that's important to understand that as well. But in the beginning, the managed care plans can decide to opt into this starting July 1st for the population of focus under behavioral health, so POF1. And then it will be mandatory for all managed care plans across the state for that particular population of focus starting January 1st, 2026. And then the remaining populations of focus will be phased in, and that's going to be communicated by DHCS at a later time. Now, it was my understanding that, like it says on the screen here, July 1st, if a managed care plan wants to opt in to this for population of focus 1, they can also look at populations of focus that are also listed on here, but definitely for the population of focus under behavioral health. And so when we talk, what we know about the population of focus under behavioral health is that the folks who meet this criteria are individuals who meet the access criteria for specialty mental health services or drug Medi-Cal or drug Medi-Cal organized delivery system. They're also experiencing or at risk of homelessness and are within a specified transitioning population, which was on that first screen that we saw right after the header of transitional rent, or are unsheltered or full service partnership. Okay. So typically this is your population that is receiving some level of service or support from their county behavioral health department. Okay. Now, for populations who, for individuals who qualify under the other populations of focus, as we get more information about what are the definitions under there, they will have to meet that definition, and then also, again, meet the definition of being at risk of homeless and also meet one of the clinical risk factors that was on that previous slide. But again, we're hoping to see more guidance come from the state. Hopefully, March, April is what we're hearing. More April, I think, about how is this going to roll out? How are they defining these? And what's the expectations on the managed care plans and the providers that they're going to be vetting for this? All right, next slide. Let's see. And then, so for round 4, when they originally had started talking about round 4, they hadn't included transitional rent. And then once they got the approval for a transitional rent, the state definitely wanted to make sure that there was capacity building for providers that wanted to come into this space. And so the application deadline was extended till May 2nd, so that providers that were looking at this could come into this. And so on the slide here, it talks about potential providers, but again, your organizations are a good base as a provider as well for this, because I'm going to assume many of you are probably maybe already providing some type of level of service around transitional rent, or you're also doing that trio of housing community supports as well. The biggest thing here for those that are looking to come into this space is that, and we already spoke about this earlier, is that if you are going to say clearly in your cited application that you are coming on as a potential transitional rent provider, that you have to make sure that you have your letter of support from the county behavioral health department. And you need that for each county that you are looking to be a transitional rent provider. And several of you, your organizations are providing these services in multiple counties, right? And so maybe you're looking to be a transitional rent provider across the spectrum of counties that you're serving. You need that letter of support from each individual county that you're looking to provide this for. So for transitional rent, what we're seeing is some additional criteria that you need to include in your application. So the other thing it's critical to do this, because in order for transitional rent and the way that the state has really envisioned this, and we're going to look at that in the next slide, is that this is a partnership between managed care plans, your county behavioral health departments, and then your transitional rent providers and all these other housing providers that you have in your local communities, and that you're all working together. And so that letter of support is your county behavioral health department saying, we're going to be in partnership with you as a transitional rent provider. Because there is that, to do that bridge to those permanent behavioral health housing programs, you've got to collaborate with them, right? So you've got to do those warm handoffs and transitions to those housing programs. So that's why this letter of support is so important. The coordination of transitional rent with county behavioral health is integral in connecting members with county behavioral health resources. The objective here is to ensure county behavioral health partners are familiar and coordinate with transitional rent providers serving their county. So counties can't say they don't know who the transitional rent providers are in their county, right? They're giving you that letter of support saying, we're going to support this provider that's looking to come on as a transitional rent provider. Now, if you are unable to obtain a letter of support, in the guidance that the state provided on the cited application, it indicates that you should note in your application your efforts to obtain that letter of support. So if you have history engaging with your county behavioral health department, if you have faced barriers in the past to try and get things from your county behavioral health department, and you're really looking to come on as a transitional rent provider, first thing I would do is reach out to them ASAP, right? Set up a meeting, start to talk to them about this and document all of this. Because if you're unable to get that letter of support, it doesn't mean that you can't apply for this funding. You just have to show your efforts to do that, right? And what I would recommend is not just one time try and you don't get anywhere and that's it, you're done. Continue to try. You know, maybe most county behavioral health departments have a mental health board and they meet monthly. Maybe attend that meeting, right? They're open to the public usually. Attend that meeting. You know, figure out who's your point person that you should be working with at that county behavioral health to get that letter of support. Now, you are not required to have contracts in place with your local county behavioral health department for this cited application. All you need is that letter of support. So it's not that you need to contract with that local behavioral health department. You just need them to say, I'm giving my stamp of approval for you to apply for this, and that we're going to support you coming on as a transitional rent provider. Okay. And Allison had already put, there is a template. She already put it in the chat. You can definitely use that. And what I would suggest is anything that you can make it easier for the county behavioral health department to just sign off a letter. You know, when you email them, attach the letter. Like Gretchen said earlier, I think what we're seeing across the state, and I know you're probably impacted by this with your organization, we have so many initiatives, mandates that we're all trying to meet, right? CalAIM isn't the only thing that all of us are working on. There's all this other stuff that's going on. And some county departments may be ahead of the game on this, and some may be falling behind on it. And so whatever you can do to make the process easier for the county behavioral health department, attach that template and maybe that will help them. Okay. Any questions so far about this? All right, let's go on to the next slide. So this slide, you know, really kind of talks through or shows you the vision that DHCS has for this. Oh, 1 second. I'm sorry. I have 1 second. I'm sorry about that. I'm here at a dental office in my sister-in-law's office in the back, and so it's Friday and they want to close up. But so so this is what the state has envisioned for how this will work, right? What's the state's role here? So the state's role here is to make sure that the managed care plans understand their roles and responsibilities here. Make sure they understand the guidance and all of that. Then the managed care plans are going to be responsible, like they were for ECM and community supports, in bringing on providers to fill this space. And then those providers are going to be the ones that are working with landlords and other additional housing providers. But what you'll see here on the screen is the role of county behavioral health as well, right? So you're going to, if you come on as a transitional rent provider, the expectation is that you're not going to be working in silo by yourself with the managed care plan, that you're all going to be working also with county behavioral health programs or ECM providers or other community support providers or other housing providers and other social service agencies that are also working with the agent, with the individual, and that there is a coordinated effort to meet the needs of that individual. And so again, once the state puts out more guidance and what their expectations are on this, then we'll better understand how this is all going to come together. There is a concept paper on transitional rent. It's on the state website. That gives a nice large overview of the vision of this, but you know, we need to know the nitty gritties. We need to know like the technical details of this as well. So that is something that we're all eagerly waiting for. Next slide. So one big thing that is coming out in the transitional rent is this concept of flex pools. And so this is a model for centrally administering rental assistance and coordinating related housing supports in a way that helps people who are experiencing or at risk of homelessness enter and maintain stable long-term housing. You know, homeless and housing was a program that I oversaw when I was working in Mariposa County. Allison and I actually worked together in this, and in my 30 plus years of working in a variety of social service programs, this housing and homelessness was one of the areas that I found to be quite complicated, to be quite honest, in that you really need to be coordinating with so many different entities for funding, for how you're meeting the needs of the individual, and how does this all flow, right? And so when this, and I think the state really thought this through around, it's not just about finding a provider that is going to do this, but it's also making sure that folks are able to really build this and keep it going. And so what you see on this slide here is this concept of, you know, there's core functions that need to happen and who could do what. And so flex pools, hub models, whatever you want to call it, it's looking at maybe there's a lead entity that is kind of coordinating and braiding the funding streams. And then you have operators who are then doing the other functions, such as it says in the first column there, there's a fiscal intermediary between the funders and the landlords. Or there is someone identifying, securing, and supporting a portfolio of units for participants. And then there's another maybe operator that's coordinating with providers or of housing supportive services to support participants. So how do you all work together, right, to meet the needs of individuals in that county, but also again, meet the needs of the providers coming on. So there's some lessons learned that I think the state has really kind of taken from the rollout of the housing trio community supports, and how do we do this 15th community support that doesn't place additional burdens on providers coming on, but really helps them to come into the space with additional support and services. Now, everyone has to be a contracted provider to administer the transitional rent benefit under the flex pool model. And the state has indicated that they will provide more information and technical assistance before the end of Q1 of this year. So that's what, like March, April. So a lot of information is coming out March, April to better understand the transitional rent space. And I think that's the last slide, I believe. Yep. So any questions about transitional rent as it relates back to the cited application? And I can't remember if we're going to do a webinar on transitional rent once the guidance and policy comes out, but this is the latest that we have on transitional rent at this point. So I'm going to hand
Yeah,
it back to Greta.
we do
Oh,
plan to have another webinar in mid to late April, hopefully once the information about transitional rent is out, so we can give those updates as well.
and just one last plug. What when you start to assess kind of where you want to come into CalAIM, you can come in as an ECM provider and then also provide community supports as well. So you're not limited to one or the other. You're not limited to just one community support, because I think many of you may find that you're providing ECM services like services already, and then you're providing 3 or 4 of the community supports. And so, you're going to be in a better place to kind of come onto this right away. And so, just to make a plug that this isn't that you have to pick one over the other or anything like that. I think for individuals, it definitely helps when it's one provider that's providing all of these services versus you've got 4 or 5 individual providers providing each one, right? Definitely, if an organization can provide a spectrum, that's always preferred. All right, back to you guys.
Thank you, Baljeet. Lots of information put out today. Floor is yours. If you have questions, please put them in the chat, raise your hand, come off mute. We have about 8 minutes left, so we'd love to answer any questions you may have.
I think it's a lot of information for
It's a lot of information. Yes. Yes.
somebody who's listening it for the first time, but we really need this funding at this time. CBOs like ours who serve minorities, we are definitely, suffering. So that's why I dared to come on this webinar. It sounds intimidating, even the topic, but I think I don't have any choice but to learn and apply for it.
Yeah.
So I am looking forward to it, and I just request that if we can get a little more support in completing this application, because I really think that we already are doing work in this realm, and probably we can do more.
Great.
Thank you.
We do want to support you guys, and we know it's a lot of information, but again, we have some time before the application is due. So hopefully we can start to really work on this and you can do some more thinking about it and come back with more concrete questions. So yeah, that was the intent today. Put it all out there. So pique your interest, hopefully, in applying. Anybody else want to jump in? Allison, go ahead.
I was just going to say, to your point, we do have quite a few support opportunities coming up for Cited specifically, but then CalAIM in general. And so all of that information will be coming through the partnership and their email blasts. And so, but just so you know, we do have a path for Cited round 4 office hours coming up next week. And then we'll have another webinar, which hopefully will have some of these updates on transitional rent. And we'll have another office hours opportunity as well.
Thank you.
I would also encourage you to go on the DHCS website and look at previous rounds that were funded. The state has put out, since the first round, they have like an Excel spreadsheet where they tell you who they funded and what did they fund. And so you will see maybe organizations that you recognize, and I know you said you're in LA and Orange, and so look at those particular counties and see what's being funded in those counties already.
I'll do that. Thank you.
Great. Well, if there aren't any other questions, I I just added a survey link into the chat. If you would give us a little bit of feedback about this meeting today and how we can further support your organization in this application or CalAIM in general, whatever is kind of top of mind for you right now and the support that you need. So Miranda just put into the chat the link for the office hours for the cited application next week. So you can add that to your calendar. And we really hope that, we know things are really unstable as far as like funding goes and everything else. And so we really think this might be an interesting opportunity to support the organization's work as you continue to support survivors on a day-to-day basis. So just thank you all so much for joining us today, and we hope to see you on a future webinar.